Hi guys, Steve from Arkansas here, talking about mental health and depression. Today, let's talk about getting through it, knowing you will make it, having faith that it too will pass. Okay? In short, don't give up. Depression is a long, hard battle, even when you're on the right medications, even when you're getting therapy. You're going to have times when you're down and out. It's the truth. Because you will have your ups and downs, and for a normal person, something simple like losing something or having a hard time getting through a bad time. Oh, I'm not sure what the words I'm looking for. Losing a loved one, okay? For a normal person, they'll have a short period of mourning, but then they'll move on. For a person with depression and mental illness, it's forever, okay? You're going to struggle and struggle and struggle and try to make it through. It's hard. It takes longer for those of us whose brains are out of balance. And as I already said, this too shall pass. It will pass. Again, let's equate it to people with alcohol or drug problems. And they go through a 7-step program. Lord, grant me the strength to change the things I can, the serenity to accept the things I cannot, and the wisdom to know the difference. Why do I equate drug and mental health? It's because they do go hand in hand. Alcohol and drugs are a form of self-medication, as we say, those of us who've been to therapy. When you have those issues, you try to battle them. And many of us turn to something to temporarily give us release from it. And it is only temporary. Drugs and alcohol are only temporary. That's unless you're a quitter. So many like say that and try to make it humorous while they're doing their drugs and alcohol, and it's just like, it's not healthy. It will end your life. You'll waste your money. You will lose what few people are left in your life if you turn to those things. Instead, say, this will pass. I will make it through this bad time and get on with my life. If you keep on fighting and you keep on trying to think positive, okay? I've talked about this in my therapy sessions. Try to find something that will make you laugh, that will cheer you up. As simple as going to a park and watching kids play and laugh. That can bring joy to most people's heart. I often turn and am currently watching Big Bang Theory. Those people make me laugh. Doesn't seem like it, does it? This is pretty much my normal expression right here. Flat affect. That's what happens with mental health. There's so few things in your life that bring you joy that you just... Emotions are hard for us unless they're extreme. And the most extreme ones that have mental health, of course, are those bipolar, manic depressive, and so forth. But that's all they have is extreme levels of emotion. And most people with mental health will have a similar one to that as well. They've tried to stick me on bipolar medications. Didn't work for me so well. Yeah. Enough about that. And therapists and psychologists, psychiatrists, you name it, they try to find different medications that work on us, and it's hit and miss. I've said this before, I'll say it again. When you first start a new medication, be careful. Sometimes all it does is make you worse, okay? But back to my main point today. It will pass. You will get through these bad times. You will move on. It will end, and you will start new. And you will be stronger for it. It's like my power is my God and Jesus. Okay? You say, I don't believe in that. You don't have to believe in that, okay? And I'm only saying this for the purpose of those out there who are saying, no, no, no. I'm not going to go to Alcoholics Anonymous. I'm not going to AA. That's all they talk about is like, okay, guys, that's an excuse. You have to believe in something to get through your mental health issues, okay? Unless you just want to be an alcoholic, unless you want to be a drug addict, unless you want to be living on the side of the street one day because your mental health is so bad you refuse to get help, okay? You have to have something that will tell you, I know I can make it through this, okay? Doesn't matter what it is, and I'm saying that sincerely. Find something that tells you I'll get past this, okay? Think of your family, your friends. Have somebody there for you when you're struggling. Don't be alone when you're struggling, okay? There'll be times you will want to be by yourself for a short period of time, okay? That's normal. But being constantly alone is not healthy for us. It's the truth. I know this very well. It's hard, guys, when you're alone. It's during times, say, I've been meaning to bring this up, the holidays. I don't know what it is about the holidays. They've talked about it, the holiday blues. And largely it's for those of us who don't have close family nearby, our family that, due to our issues, we push away. Stop pushing. Now, some families are toxic, okay? You know them. When you get around them, immediately the fighting starts. They say things that hurt your feelings, etc. Not around those. There's other people you can turn to that will be positive to you, okay? During the holidays. Go with them, be around them, be happy. It's not that hard to find somebody that you know that can make you smile, that you know is safe to be around, that you know will lift you up, okay? It will pass, you will get on, and you will learn to laugh, okay? Joy is at times fleeting, but it is there for us. Happiness is there, and it can be there much longer. Don't look for things that will only give you temporary pleasure. That doesn't help your mental health. It's fine for a moment, but you need something long term that this will help me make it through this. Whether it's a higher power, a loved one, your significant other, your husband, your wife, and hang on to them for dear life. Don't let them go. Don't drive them off. They've been there for you, and they've seen you struggle through these, and they want to be there for you. Give them a break every now and then. Let them know, I'm fine today. You go out, or you go with them. Sometimes they get tired because all you want to do is crawl into your corner and lay there and do nothing. Think about it. That's what brings on racing thoughts. Get out and enjoy life, guys. It's difficult. It is. I know it is. Make no mistake about it. There are times when you need to go outside. Enjoy the air. I've said that before. Enjoy the sunshine. Sunshine. When it's sunny outside, go out there and feel it. It does help mental health disorders. Going out, exercise, that helps mental health disorders. Find something that you can enjoy, that's something that brings you some enjoyment. Watching kids play, watching your favorite movie, it'll make you enjoyment. Now, let's say it's like you're contradicting yourself. There's different types of temporary pleasures, guys, okay? Hopping in a sack with some random stranger that you know you're not going anywhere with. That's temporary pleasure. Getting drunk, that's temporary pleasure. Doing drugs, that's temporary pleasure. Going to a movie that you know will make you laugh. Seeing a comedy show that will make you laugh. Uplifting comedy show, please. Not necessarily Eddie Murphy or Richard Pryor, because people say they make you laugh. They make you uncomfortable more often than not. They don't actually make you laugh. As I said, Big Bang Theory. Look for some clean comedy. Something that tells you is like, guys, we can have fun and we can do it in a non-insulting way, in a non-profane way, in a non-enjoying somebody else's discomfort way. Find something that will make you smile and relieve that stress in your body that's always there. You can feel it. There's times when I've gritted my teeth so hard that it's actually made my jaws hurt. There's times where I've been so tense, like I can't release it. Then my skin starts crawling and the anxiety acts up. You gotta find some kind of release out there that will help you feel better for that moment. Yelling, hollering, cursing, putting your fist through the wall, that doesn't solve anything, and it can make situations worse. Find some way, walk away for a moment, catch your breath, practice your mindfulness, take a moment, take a deep breath, drink a glass of water, then go do something you can enjoy. As I know those of us with depression, you can't focus on something for very long. Then do something you can enjoy. Going for a walk. Going to a playground and watching kids play. Find something that can bring you joy, that you can sit there and know you won't be crawling back into bed after 5 minutes. Yeah, I've done that. I've turned the show, oh, I enjoy this. 15 minutes later, all of a sudden I'm crawling back in bed. Not healthy. So, get outside and walk. Get outside and get some sun. If you have a significant other, let them know how you're feeling. Go to your wife or your husband and say, it's like, I really need you right now. I really need you to hold me. And if they will, let's make love. And know that there are people that care about you. Know that this bad time will pass. You will get through it. You will get through the valley, get back to the mountaintop. Not necessarily the mountaintop, near the top. No, I made it. Don't let mental health get the best of you. Know that you can make it through this, and know that there are people that care about you. There are. We often say it's like nobody cares about us anymore. It's like sometimes we actually try to make ourselves believe it. But there isn't. There's people out there that do care about you. It's like treat others the way you want to be treated. And know you can make it. You'll make it through the other side. You will survive. There will be a tomorrow. Your past, you've learned from your past. And you learning from your past, you know you didn't make the mistakes that you could have in the present. And you'll move to the future. And then you'll smile and enjoy life again. Okay, guys? I hope I helped somebody today. This is Stephen from Arkansas. I hope everyone has a blessed day. Thank you. Bye.